Hey there, welcome back to Dementia's Longest Goodbye. I am Dr. Amy and I am a geriatrician. And today I just wanted to get into a topic that, I know there's a lot of confusion about it, especially when I look up various articles or see various gurus online talking about dementia. And if you're like many people, you're probably wondering, you hear the word thrown around and you're wondering, what is dementia? What is it? So I'm going to clear things up for you a little bit today. And I brought with me today my one of my mini brains. And this is just a reminder that this is what we're talking about. We're talking about our brain. And what I have in my hand here is a model, but it's also really one of the most powerful computers that we have in the universe, our brain. And we're still learning a lot about it. But when we think about dementia, any type of dementia, and there are very many different types, what we think about is, or what we know dementia to be, is something that affects this organ. So it is not a specific disease. Dementia is not a specific disease. In fact, it's a general term. So we can think about it as an umbrella, really, or even a bucket, right? And it covers a variety of different conditions, different types of diseases, different types of things that affect this one brain. And we see it as changes in somebody's memory, somebody's way of thinking, and the way they behave. So, for example, let's think of it like this. So somebody says they have a fever, right? So we know that it's a symptom of something, but it doesn't tell you what's causing the fever, right? It just tells you that there's something going on. So dementia is the same. It's a symptom of different types of brain diseases. But what we see of it is somebody's thinking, their memory, or their behavior is different. Okay? So let's just take off the table one of the biggest misconceptions about dementia. So it is not a normal part of aging. As we get older, we do not have to forget. As we get older, we do not have to start, changing the way we do things or even forgetting the people we know. We might experience a little bit of forgetfulness. So I call it absent-mindedness. So somebody says, for example, my mom will put her keys down and she'll walk away and say, well, I really did not, I don't remember where I put my keys. But the difference between her and somebody with dementia is she is aware that she's looking for her keys. Somebody with dementia has no idea what keys are. They don't know what to do with them. Okay? This person is not aware that they need keys to drive a car. Whereas my mom will say, I know I put my keys down with my purse, maybe. It was there a second ago, but I don't remember what I did with it. Or another example that I know people ask me about all the time, and they say, boy, am I starting to have dementia? Is that I walked into a room and, man, I don't remember why I walked in here, right? Hasn't that ever happened to you? You walk into a room and you say, but why did I come in here? You walk back out, and a few minutes later you remember, oh, that's right, I was looking for X. But someone with dementia doesn't even recognize that they're in their own house. So that is the difference between what we consider to be normal aging versus someone who has like a real change in just the way they function in their life as a result of a brain, as a result of a disease, which is affecting the way that their brain functions. Let's see if I can get that. Yeah, there we go. So let me just tell you a story. And as you can imagine, as a geriatrician, I have been through medical school. I have been through residency training in internal medicine. and I went on to do my subspecialty training in geriatrics. And then I've also done, seeing patients clinically. And for me, one of the places that I most enjoyed seeing patients was in their homes. And I've also seen patients in the nursing home and long term care and also in the hospital. So I have so many stories that I can share with you. But I will tell you one about a young man, about a man that I will call John. So, very short, and his family remembers him as a very jovial man in his 60s. And then one day, his wife noticed that, he couldn't follow conversations. So she would be talking to him, and from one moment to the next, he just couldn't grasp what she was trying to say. So she just said, we're kind of getting older. Maybe it's just old age catching up to us, you know. And then that just became, well, now we're driving, but he's forgetting where we're going. So they're sitting in the car and he's getting ready to go and he's asking her, well, where are we? Where are we going? Why are we in here? Right? That's not normal. So later on, he was diagnosed with Alzheimer's disease. And I tell you this story to make you think that you never sit in your car and ask, where am I? Right? You might sit in your car and say, you know what, I really felt like I want to drive this way, but no, I think I'm going to go somewhere else. So that's another example of one of the ways that, dementia as a disease affects somebody's ability to function in their life. So dementia is not just forgetting, right? It's not just absent-mindedness, which is what we see typically as we get older. Dementia is really somebody's ability to function and live independently. And I'm really stressing it to make a distinction, make a difference between what is normal and what is not normal, because frequently those lines get blurred, and a lot of times families will accept what we know to be signs of dementia as normal, simply because as a society that we just grow to accept that as we get older we're going to forget, right? Which is not true. So the important part is that we do not have to have dementia. This brain of ours, this wonderful brain that every human being has, does not have to forget in a way that prevents us from living our lives. Okay, everyone? And I think that with the latest research that we have that demonstrates to us that simple everyday things can help us decrease our risk of developing dementia, really brings home the point that even if, you might even have somebody in your family with dementia, we can decrease the risk, or we can at least slow down the fact that we may at some point in our lives develop dementia, but it is not something that has to happen to everyone. Okay? So we will talk about the different ways that we can decrease our risk or slow down the progression or slow down the, what we see to be changes in our memory over time in future videos. I also want to hammer home to you the misconception or the myth or the wrong idea that all dementia is the same. There are so many different types of dementia, right? I'm going to name a couple that we know to be, because they're the most prevalent. They're the ones that we see all the time. Alzheimer's disease is the most common one. And things that we see there is language, right? People have problems with language. They can't get the words out. They can't find the right words. We have another one, vascular dementia, which really affects people who have high blood pressure. It's a disease of their blood vessels, okay? Then there's Lewy body dementia. There's frontotemporal dementia. And what I believe to be even more common than all of these is mixed dementia, where you can have somebody with Alzheimer's disease and vascular dementia. Okay, um, they're not all the same, so they affect us all in different ways. Okay, vascular dementia is a blood flow problem, so you might have high blood pressure, or you might have some sort of disease with your blood vessels, or cardiovascular disease, plaque, or whatever. That affects how you make your decisions. That affects how you move your body. Whereas you look at somebody with Alzheimer's disease and they can't remember the words. Okay? So different types of dementia look different ways because they affect your brain in different ways. So understanding these differences is key because it helps families get the right care that they need for their loved ones. And as a caregiver, it's important to remember that the journey that your loved one is on is not going to look the same as everybody else's. And, you know, sometimes the journey that one person starts on is not the same for them overall, right? It changes. The face of dementia changes as our loved ones progress. And even what works for one person does not work for another one. So a lot of times we hear people say, well, this is the strategy that you use for somebody with this dementia. Well, it may not work for everyone simply because the journey is different and the causes of dementia are different. And you might have somebody who overwhelmingly, if you ever could look at their brain, they have a dementia that looks overwhelmingly like Alzheimer's disease, but they also have a little bit of vascular dementia as well. And the things that they would need, as opposed to somebody with strictly Alzheimer's disease, the care that they need at home, what their journey looks like, may be very different, right? The way that they progress may be very different from each other. So I know that all of this can be overwhelming, but I am here to tell you that you are not alone, okay? My goal on this channel, this podcast, is to give you the tools and the knowledge to help you navigate dementia with more confidence and more understanding of the disease. A lot of times we get very fearful of things, and we don't realize that with a little bit of understanding and a little bit of, just courage to look the disease in the face and really see it for what it is, gives us not just the strength, but also the confidence to deal with what it's going to bring us from moment to moment. So whether you are caring for a loved one or you're just concerned about your own brain health, it is important to separate what the facts are from what the myths may be and really understand what dementia is from all different aspects. So just to recap, dementia is a disease of our brain. It is not a single disease. It is not a normal part of aging. There are different types of dementia that affect our brains in different ways. They affect people in different ways. And even if people may have the same type of dementia, they may not look the same. Their journeys may all be different. So in future videos, I am going to walk the journey with you. We will explore together what these different types are, and we will go in detail to what what those mean, what they look like, what people can do when you're caring for your loved one to understand the diseases. But I hope that the information that I've brought to you in this video gives you some value and helps to clear up a little bit of confusion that you may be feeling as to what is dementia overall, especially if you have a loved one or you yourself have just received a diagnosis and you feel very confused. You're looking online, and I can tell you there's a lot of things on the internet that are not correct but are extremely scary. So if you have found this helpful, please subscribe and follow along. Feel free to leave any questions or comments there below, and let's continue the journey together. So thanks for watching, and remember, I'm here for you.